What about articular lesions in the hip joint? Well, the first option, of course, is an arthrosis. And in that case, what are we going to find? Well, a capsular pattern with a harder end feel. And remember that the main elements of the capsular pattern are a limitation of medial rotation, which is bigger than the limitation of flexion. And the function is very important. You can watch a radiograph and see different signs of degeneration, but it's quite possible that the function still is better than what you see on the radiograph. So let's not treat X-rays, but let's have a look at the function. And of course, signs of degeneration in the hip joint are very, very common as from a certain age. What can we do in case of a hip arthrosis if it's not too advanced? Yeah, that means if the end feel is not bony hard. Yeah. Or in an arthritis, well, we can do capsular stretch. And the capsular stretch is going to have pretty soon an effect on the pain at night and the pain on walking. We're going to stretch in 3 different directions. In flexion, we go to the end of the movement, we go a little bit further, and we stretch. We do exactly the same in extension and in medial rotation. This is a little bit the more, let's say, annoying movement. We play about 20 minutes in the treatment session with those capsular stretch techniques, and of course the patient also has to do some home stretch exercise. Perhaps we find something else, arthrosis with a loose body or internal derangement, and we hear the internal derangement, just like in the elbow and the knee joint. The patient is talking about twinges. The patient has a feeling of giving way. And where does he have twinges? Well, anterior aspect of the thigh and the groin. And those symptoms are really very irregular, very intermittent. And we hope that standard X-ray is negative, because if we see something like this, then of course, this patient needs surgery. This kind of loose bodies, those bony loose bodies, need to be removed as soon as possible, because otherwise they're going to cause even more damage in the joint. And we saw exactly the same in the knee and in the elbow. Clinically, so if a patient has arthrosis, we expect a capsular pattern. But if a loose body is, let's say, playing a big role, then the capsular pattern automatically changes in a non-capsular pattern. We're going to notice that now flexion is more limited than normal, and we don't reach this harder end feel anymore. And possibly the passive lateral rotation now is more painful than the passive medial rotation. And in the normal capsular pattern, passive lateral rotation is not positive. So the clinical image is changing, but the key element is the history. So as long as we don't have any bony loose bodies, as long as the X-ray is negative, we can treat, as we did in the knee and in the elbow. Again, I refer to the specific films on treatment techniques where I explain you in detail how you can perform this manipulation. But the logic is always the same. We're going to build in a traction component and a rotation component in order to try to shift the loose body somewhere else into a so-called silent zone where it doesn't interfere too much anymore with articular mobility. The grip is going to be important, more specifically for the comfort of the patient. We can do this technique with a lateral rotation component or with a medial rotation component. And as always, you do a technique once, you check the positive test in the examination, and if something changed, then okay. If it's better, then we repeat the same technique all over again. If it's not extra better, then you can try the other rotation, or you can even try another technique. We have two different techniques for loose body. This technique looks a little bit less spectacular, but to be honest, it is more difficult to perform. But the first technique you saw is in fact for us the most important technique. But also in this technique we have a combination of a traction component and a rotation component. Let's imagine the patient has a rheumatoid arthritis. Well, they certainly are going to describe some pain after exertion. They have a slight capsular pattern. And, well, an intra-articular injection could be an interesting option. But there is some controversy on the risk on steroid arthropathy. According to some references, it's wise not to give more than 2 times a year a hip intra-articular injection, but because it might be dangerous, because it's a weight-bearing joint, so it might be a risk for the cartilage. But on the other hand, there are studies talking about repeated injections in the knee, up to 4 injections per year, without any harmful effects short-term and long-term. Anyhow, physiotherapy is always indicated. This patient also needs movement, and with this patient, if it's not too acute, we can also do capsular stretch techniques. And some patients, they also describe morning pain and stiffness, and the reason for that is probably the accumulation of intracapsular swelling during the night. So that's absolutely not abnormal. Patient with ankylosing spondylitis, well, we know the evolution. It starts in the sacroiliac joints, mostly asymptomatic. Then it goes to the lumbar spine, mostly asymptomatic, and once it's in the thoracic spine, then it starts being symptomatic, then it goes to the cervical spine, and then it jumps to the extremities, for instance in the hips. So if the ankylosing spondylitis already affected the hips, then that means that the disease is already in an advanced stage. And of course, the treatment of ankylosing spondylitis is a little bit more than just capsular stretching and mobilization, but I talk more about that in the specific chapter in the spine module. A rare option is an internal derangement or loose body in a non-arthrotic joint, and this is really rare. Yeah, we have the same story again, twinges, giving way, pain in the groin, anterior leg, and perhaps you find in the examination passive flexion and lateral rotation, which are painful, but this is perhaps, this is not a certainty. But the manipulation you just saw for loose body can also be used in that case, as long as it's not a bony loose body. But this story of internal derangement might be similar to the story of a labral tear. And that's quite important to mention, because these labral tears, they are not infrequent. The question is, how can we test that? And this was a very interesting article on diagnostic tests to diagnose labral pathology of the hip. And they came to the conclusion that, okay, labral tears occur in about 22 to 55% of the patients. And what are they telling you? They have pain, they have a feeling of locking, an instability feeling, giving way, some stiffness. Because, as I just mentioned, those are very similar symptoms as the patients with a loose body. So I come back to the question, which tests can we use? And in this article they studied some popular tests, but we have one big problem. All those tests seem to have a very poor reliability, except the impingement test, which has a kappa value of 0.58, which is also not so spectacular good. And how does that look like, this impingement test? Well, we build in some flexion, we build in some adduction, some medial rotation, and then we provoke. And we hope to provoke the patient's, or to provoke the patient's symptoms. What about femoroacetabular impingement? This was also an interesting article about a home exercise program for a young patient. And they also described in this article that this femoroacetabular impingement occurs in the presence of morphological abnormalities, so that there is a kind of impingement. Cartilage can be damaged, you can have labral abnormalities, you could create a secondary arthritis. But the clinical image could also be confusing. We could also think of a loose body. And specifically in this article, they gave the patient an exercise program. And what do you notice? It's an exercise program also by using some traction components. So you can imagine, if there is a structural problem, then that's not going to change too much. If there is really a morphological symptomatic problem, this kind of exercise are not going to give so much benefit. But if a loose body is also playing a role, then it's quite possible when you do this kind of exercises that you also have an effect on an internal derangement. But that's perhaps something to think about.